Welcome back to the channel. Today we're diving into a crucial topic that could potentially save lives. We're talking about cancer awareness, and more specifically, how your sense of smell could provide early warning signs. Did you know that certain smells can be early indicators of cancer? It might sound surprising, but our bodies often send subtle signals when something isn't quite right, and changes in smell can be one of them. Let's explore 8 cancer smells you should never ignore. Remember, this video is for informational purposes only and is not a substitute for professional medical advice. If you experience any of these symptoms, consult a healthcare professional for proper diagnosis and treatment. Our first smell is a persistent foul odor coming from the mouth. Now, we all have morning breath, and that's perfectly normal, but if you're experiencing a chronic foul smell that doesn't go away with brushing, flossing, or mouthwash, it could be a sign of something more serious. Oral cancer, a type of cancer that affects the mouth, tongue, and throat, can sometimes manifest with a persistent bad breath. This foul odor can be caused by the growth of cancerous cells and the breakdown of tissue in the mouth. Early detection of oral cancer is crucial for successful treatment. So if you're experiencing a persistent foul smell, don't hesitate to schedule an appointment with your dentist or doctor. They can perform a thorough examination and determine the underlying cause of the odor. Remember, not all cases of bad breath are linked to oral cancer. Other factors like gum disease, poor oral hygiene, and certain medications can also contribute to bad breath. The key here is to be aware of any changes in your body, including persistent changes in your breath. If something seems off, trust your instincts and seek professional medical advice. Your health is your wealth, and early detection is always the best approach when it comes to cancer. Now let's talk about changes in your body odor. We all have our own unique scent, but if you notice a sudden, drastic and unusual change in your body odor, it's worth paying attention to. Skin cancer, the abnormal growth of skin cells, can sometimes manifest with a strong, unusual body odor. This odor can vary depending on the type and location of the skin cancer. For example, basal cell carcinoma, the most common type of skin cancer, may cause a sore that doesn't heal or bleeds easily and can sometimes emit a foul odor. Melanoma, a more serious type of skin cancer, can also cause changes in the skin's appearance and odor. If you notice any unusual growths, sores, or changes in your skin's odor, it's essential to see a dermatologist immediately. They can examine your skin, determine the cause of the changes, and recommend the appropriate treatment if necessary. Remember, early detection is key when it comes to skin cancer. Regularly examining your skin for any changes and seeking professional medical advice if you notice anything unusual can significantly increase the chances of successful treatment. Let's move on to another smell that should never be ignored, a persistent fishy odor, particularly from the vaginal area. While occasional changes in vaginal odor are normal, a persistent fishy smell could be a sign of something more serious, like cervical cancer. Cervical cancer affects the cervix, the lower part of the uterus that connects to the vagina. A persistent fishy smell, often accompanied by unusual vaginal discharge, can be an early symptom of this type of cancer. This odor is often caused by the abnormal growth of cells in the cervix, leading to changes in vaginal discharge and a distinct fishy smell. If you notice this symptom, it's crucial to consult your gynecologist promptly for a proper diagnosis. They may perform a PEEP smear, a screening test that checks for abnormal cells in the cervix to rule out or confirm cervical cancer. Early detection and treatment are essential for improving outcomes associated with cervical cancer. Remember, not all cases of a fishy vaginal odor indicate cancer. Bacterial vaginosis, a common bacterial infection, can also cause a similar smell. However, it's always best to err on the side of caution and seek professional medical advice if you experience this symptom. Our next smell might surprise you, a sweet, fruity breath odor. It might seem counterintuitive, but this unusual smell can actually be a sign of lung cancer. While lung cancer is often associated with a persistent cough and shortness of breath, Some people may experience a sweet, fruity breath odor as an early symptom. This peculiar smell is caused by the tumor's production of certain chemicals that are released into the breath. It's important to note that a sweet, fruity breath odor can also be a sign of other medical conditions, such as uncontrolled diabetes. However, if you notice this symptom, especially if you have a history of smoking or exposure to secondhand smoke, it's crucial to consult your doctor immediately. They can perform a thorough evaluation, including a physical exam, imaging tests, and possibly a biopsy, to determine the underlying cause of the sweet, fruity breath odor. Early diagnosis and treatment of lung cancer are crucial for improving survival rates. Moving on, let's discuss another unusual smell that could indicate a serious health problem, a musty odor. While a musty smell in your home is often associated with dampness or mold, a musty smell emanating from your body could be a sign of liver cancer. Liver cancer, a cancer that originates in the liver, can sometimes manifest with a distinct musty odor. This odor is caused by the buildup of bilirubin in the body, a yellow pigment that is produced during the breakdown of red blood cells. When the liver is functioning properly, it filters bilirubin from the blood. However, when cancer affects the liver, it can interfere with this process, leading to a buildup of bilirubin and a musty odor. If you notice a persistent musty smell, especially if it's accompanied by other symptoms like jaundice, yellowing of the skin and eyes, abdominal pain, or unexplained weight loss, it's essential to consult your doctor immediately. They can perform blood tests, imaging scans, and other tests to evaluate your liver function and rule out or confirm liver cancer. Now let's address a sensitive but important topic: foul-smelling discharge from the rectum. While occasional changes in bowel movements and rectal discharge are normal, a persistent foul odor could be a sign of anal cancer. Anal cancer is a rare type of cancer that affects the anal canal, the short passageway that connects the rectum to the anus. A foul-smelling discharge, often accompanied by bleeding, pain, or itching in the anal area, can be an early symptom of this type of cancer. The odor is caused by the abnormal growth of cells in the anal canal, leading to changes in rectal discharge and a distinct foul smell. If you notice this symptom, it's crucial to overcome any embarrassment and consult your doctor immediately. They can perform a physical exam, including a digital rectal exam, and may recommend further tests like an anoscopy or a biopsy to rule out or confirm anal cancer. Early detection and treatment are essential for improving outcomes associated with anal cancer. Let's move on to another unusual smell that could indicate a serious health problem, a persistent metallic smell, particularly in your urine. While certain foods and medications can temporarily alter the smell of your urine, a persistent metallic odor could be a sign of kidney cancer. Kidney cancer, a cancer that originates in the kidneys, can sometimes manifest with a distinct metallic smell in the urine. This odor is caused by the presence of blood in the urine, a condition known as hematuria. Blood in the urine can be a sign of several medical conditions, including kidney stones, urinary tract infections, and kidney cancer. If you notice a persistent metallic smell in your urine, especially if it's accompanied by other symptoms like pain during urination, frequent urination, or back pain, it's crucial to consult your doctor immediately. They can perform a urinalysis, a test that examines the physical and chemical properties of your urine to look for blood and other abnormalities. Based on the results of the urinalysis, they may recommend further tests, such as imaging scans or a biopsy, to rule out or confirm kidney cancer. Finally, let's talk about a strong ammonia-like smell in your urine. While a mild ammonia-like odor is normal, especially when your urine is concentrated, a strong and persistent ammonia smell could be a sign of bladder cancer. Bladder cancer, a cancer that begins in the bladder, can sometimes cause changes in the smell of your urine. This pungent odor is often caused by the presence of blood and other substances in the urine, which can create an ammonia-like smell. If you notice a strong ammonia-like smell in your urine that persists for more than a few days, it's essential to consult your doctor. They can perform a urinalysis to check for blood, bacteria, and other abnormalities in your urine. Based on the urinalysis results, they may recommend further tests such as a cystoscopy, a procedure that allows your doctor to visualize the inside of your bladder using a thin lighted tube. Early detection and treatment are crucial for improving outcomes associated with bladder cancer. If you notice any of these smells, don't ignore them. Consult a healthcare professional immediately. Early detection can make a huge difference. Stay informed, stay healthy. Don't forget to like, share and subscribe for more health tips and information.